Good day. Thank you for joining the Tools for Revenue Generation webinar. My name is Deborah Lane, and I am a program specialist on the Network Technical Assistance team at Rural Health Innovations. At Rural Health Innovations, we provide the technical assistance for HRSA grantees in the areas of allied workforce development and rural network development. The RHI is a subsidiary of the National Rural Health Resource Center, and we often refer to ourselves as the center, which is a nonprofit that we solely dedicate the work that we do toward sustaining and improving health in rural communities. And when we look at our areas of work, and many of the areas of work that you as networks are doing fall into these 5 core areas, with one of them being transition to value and population health. Network, of course, is a collaboration and a partnership, so we do a lot of work around collaboration and partnership development. We work with performance improvement. We have staff members that are specialists in the health information technology area, and also staff members that focus on workforce development. Before we dig into the meat of our presentation today, I would like you to make sure that you have these files downloaded and on your desktop. The Business Planning Canvas handout, the Business Planning Canvas worksheet, the Product and Service Case Study, Product and Service handout, and the Product and Service worksheet. Now, it would be very helpful if you would take time and pause the recording and print the Product and Service handout out along with the Product and Service worksheet. And also, it may be helpful to have that product and service case study. So at this point, we'll give you an opportunity to pause, and then we'll go on with the webinar. One of the things that you set out with in mind when you start working on a grant or format network, you have a purpose, and you want that purpose to go on beyond the life of a grant. You want that purpose to go on beyond the group of people that started the network. You want it to be sustainable. And for today's purpose, when we look at sustainable, we're really thinking about being able to maintain things at a certain level or rate. So where you're able to work your project to, when grant funding is done, your ultimate goal really is to be sustainable. And a way to do that is to develop services. And when I look at the various services, they are, I call some of them hard S's. Hard S's are those things that are very tangible. You receive payment for them. They're quantifiable. Examples might be chronic care management, care coordination, a dental visit, curriculum development, training, community health worker services, navigators, shared IT, the list go on and on. And then there's another kind of service that I like to call the soft S's. And these are the things that the network does that network members value. And they want to support the network because they value things like advocacy, lower absenteeism in schools, helping write grants, doing training, just building a collaboration. And so when we think about products and services, we're looking at a really broad spectrum of things that are tangible, but things also that are less tangible, but our members really value and support those. So when we think about sustainability, I look at there being 3 formulas. We either have those hard S's, those tangible things, or we have a whole bunch of soft S's, things that our members are value enough that they would be willing to pay dues and do in-kind services, or we have a combination of them. it all amounts to network revenue generation. This revenue isn't always in dollars. Remember, keep in mind that sometimes the sustainability factor is actually a series of a bunch of in-kind services as well. Your network needs to be smart about identifying these services in order to garner the needed support, either by your network members or the needed support by the general public that is going to be paying for services. It's also important that you know how to communicate these services to members and to the general public with key messages. And so with our time together in this webinar, I want to introduce two tools that will help you begin to develop activities that will make your work sustainable, or for some of you who already are feeling you're sustainable and have services, it'll help you with further development of those sustainable services. One of those tools is the Product and Service Designer. That's one of those things that I asked you to download and print off. It's a way of discovering the fit between your members' needs and what your network can offer. The second tool is the Business Planning Canvas. And once you find that fit, you need to figure out how feasible is it to do. And this can be done by using the Business Planning Canvas. Also, there's an element of really using this tool, and I often suggest networks use this tool, to really figure out the process of implementing that perfect fit or that perfect product or service. Now, some of you on this webinar may have seen one or both of these tools before, and RHI, we use them in a number of different situations. And so this is just an opportunity for you to learn how to take and use them in another way and in other situations. Now, the Product and Service Designer, it has four general purposes. One of them being to figure out how to describe the value of your network to your members. That's the time that we've used this tool a number of different places. Another reason to use this particular tool is to identify the future directions that your network might want to go. Your grant has finished, or you're ready to do some really strategic thinking about what are we going to be as an organization 5 years from now. This tool is really helpful to do that. Another way is it's used to identify particular target markets. And finally, how to establish key messages for particular products and services. The second tool is that Business Planning Canvas. And I look at this, as I said before, as a tool to figure out how you're going to implement this perfect fit, this new product or service. And also, it's used to determine the product and service feasibility. So if you've identified 2 or 3 different products by doing a business canvas for each of those products, you will know how easy it is or what the cost is and so forth to take and implement that particular best fit. So let's dig a little bit deeper into the Product and Service Designer. First step to do is to do the members' needs assessment. This is about observing what's going on with your members. When we are going through these segments, we're going to take and look at it from a member's perspective, from an individual perspective, personally and as an organization. And that's the right side, and we start on the right side. Once we know what the members need, then we can begin to identify what products and services that the network can provide in order to meet those needs. We will move to the left side of the canvas, which is about designing, it's about determining those services, either the hard S or the soft S. This is where we create value for our members. We shift our thinking from that as an individual to thinking as a collective, or looking at things from a network perspective. So let's dive deeper into that member needs assessment side. The first piece is members' jobs. Tasks are critical success factors to your members. What they want to get done. What problems are they trying to solve? Needs that they're trying to satisfy, or tasks that they're trying to complete. Sometimes we can look at our outcome measures and our evaluation plan and assess some jobs. What functional jobs are your organization trying to do? Are your organizations doing? Are they trying to decrease emergency department usage by persons with asthma? Are they trying to implement an anti-bullying campaign? Are they training providers? Are they training community health workers on sexual assault? What are the social jobs that organizations are trying to get done? Increase access to health care, address disparities, build a healthier population. What emotional jobs are your organizations trying to get done? Are they trying to empower diabetics to better care for themselves? Are they working toward a population that is more secure because of health access? From the compiled list of jobs or critical success factors, we next look at our members' pains. What are their frustrations? What are the negatives that our members experience while trying to achieve the task or the work that they're trying to do? What things are annoying? What are the challenges? What are the fears? What are the risks? Then looking at the members' gains. This describes the reason your members exist, what they want to achieve, the job or problem that they're trying to solve. And so when we look at our members' gains, what are things that they need to have happen? What are things that would make their job easier? So those are the things that we look at when we look at the members' gains. Now, the ideas in each of these areas can be grouped together, and so we're going to start to see some underlying issues and really start to strategically think about what products and services can take and meet our members' needs. I was thinking one of the best ways for us to really see how this tool works is to do a case study. And these actually are things from a network that use this tool to determine what that fit is, what that product or services that that network could provide in order to be sustainable. So the network that we're talking about, its vision is women in rural areas of our state will experience optimal health and wellness. And its mission is, the network's mission is to build our partners' capacity to cultivate and promote innovative policies, practices, and services that improve health for women in rural areas. When you look at your case study sheet, you'll see the vision and the mission on there. The goals of this network and its project were to strengthen the capacity of the network, to improve health information and services for women in rural areas, to increase access to the coordination of sexual violence services for women in rural areas, and to positively impact rural women's health through advocacy and policy change. So that gives you a little bit of background on who that network was. So now looking at their members' jobs, and remember Members' jobs are those critical success factors that your members want to get done, the problems that they're trying to solve, the needs that they're trying to meet, and the tasks they're trying to get done. So in this situation, the members' jobs were to provide training, recruit and retention of providers, so workforce issues, access to care, to improve women's health, and teen wellness. Moving to what this network saw as their members' pain, and now remember, members' pains are the frustrations or the negatives experienced while trying to achieve their work, things that are annoying, things that are challenges. Some of their members' pains were the retention of culturally competent staff, coordination of women's health services, isolation, lack of resources, perceived lack of problem or need, lack of engagement, cultural acceptance of family planning, and shared vision of women's health. The members' gains. And this describes the reason your members want to achieve the task or the job or solve the problem. It's the outcomes, it's the benefits that the members want to have happen or desire to have happen. And often answers the question is, what would make our job easier? And they say healthy babies and healthy women, more rural providers, increased support for family planning, increased access to quality services, comprehensive services and choices, equal access to care, health equity, and support of stakeholders. This is time for you to pause the recording and look at the Designing Products and Services worksheet. And I'd like you to turn to page 2 of that worksheet and take some time, if it's you as an individual listening to this webinar, or if you have a group of network, either members or staff members with you, to use page 2 to brainstorm what some of the jobs are that your network members are doing. What tasks are they trying to accomplish? And networks so often are made up of such a variety of members that there's a lot of jobs that these networks are, or that these members are doing in varied and different jobs. But it's extremely important as a network leader to know what those jobs are. And then after you've listed the jobs, go to page 3 and start listing what some of the pains are of them. What are the things that are getting in the way of them solving their, or doing their work? And then finally, what are some of the things that they really would like to have happen to make their work easier or their gains? And so spend some time doing this brainstorming individually, and then share with others that are in the room, and start to group some of these ideas, because that will help you as you move forward. So I'll give you time to pause to do that. Now we can begin to identify what products and services that the network can provide to meet the needs that you just identified. We're moving to the other side of the canvas, which is about designing or determining those services, either the hard S or the soft S. And remember that this is where we start to create the value for our members, why they should belong to our network. We are shifting from thinking as an individual to thinking as a collective and looking at things from the network perspective. From the compiled list of pains and gains, we identify the pain relievers and gain creators. We ask ourselves, what can the network do to create the gains and relieve the pains? And then these could be ranked according to relevancy and intensity. So gain creators. What can the network do to create the gains that you listed in the members' needs assessment portion? Pain relievers. What can the network do to relieve those pains that you accumulated on the right side of this canvas? And finally, what are the products and services? This section requires you to analyze and synthesize the needs of your members into specific products or services that are aligned with your network's mission and vision. And allow yourself to consider some of these needs from a fresh look at your members' critical success factors associated with those pains and those gains. I often find that when networks use this tool, they come up with things that they haven't thought about before because of the ideas that are brought forth. So give yourself that opportunity to try looking at things from a fresh and new way. The pain relievers for the case study network. Remember, these are the things that can relieve the pains that were listed over on the right side of our canvas. To promote the health of women across the lifespan. Some other pain relievers would be to do direct services and technical assistance, to develop a position paper or white paper, to convene and coordinate community resources, identify community champions, do advocacy work, develop rural residency programs, and education of clinical providers. So what were the gain creators? Now the gain creators, remember, are those things that the network can do to create the positive things, things that need to take and happen to make them do their job easier. And some of these gain creators that this network identified were to connect to resources, utilize webinars and telemedicine, mobile care, expand the network to non-traditional partners, training and education, writing letters of support, a marketing campaign, and learn how to take and broker relationships. Here's time for discussion again. Pause, and looking at page 4 of your Product and Service Designer worksheet, you'll see a spot where you can take and list the pain relievers and the gain creators. So spend some time doing that brainstorming. And again, if there's more than one of you listening to this webinar, or if you're using this for your entire network, it's time to do some sharing after you're done brainstorming and start grouping some of these ideas. And things are going to start to come together, and you'll start to see patterns in what is happening. So I'm going to give you a moment to pause the recording and do this work. Once you have identified what those pain relievers and those gain creators could be, almost without exception, patterns start to develop. And you'll see some common things in the gain creators and pain relievers. And so from that analysis, and this is that fun part, this is where that analysis happens, you can start coming up with various products and services that your network can offer. And the case study, they came up with ideas related to women's preconception health webinars, sexual violence training curriculum, develop an adolescent health champion in various communities, connect CHCs and universities and providers and hospitals, develop forensics exam sites, a symposium, and fund physical exam rooms and equipment and service training. And the fit that this network came up with to do their business planning canvas on was the sexual violence curriculum. Now is another time to pause in using the information that you acquired in what the pain relievers and gain creators were for your particular network. Start doing the fun work, that analysis and that synthesis, and using page 5 of your product and service designer worksheet, and start to put some of those ideas together. What are some possible products or services that you could offer as a network to meet your members' needs? Well, I'll give you a moment to do that. Quickly moving on with the tool, one of the things that I mentioned that this tool can be used for is to create key messages, sometimes called value propositions. And these key messages and value propositions are made up of the service, the pain reliever or gain creator, and the pain or the gain that that pain reliever or gain creator is addressing. And sometimes it's multiple pains or multiple gains. In our case study, the service was the sexual violence training curriculum. The pain reliever or gain creator was to educate clinical health staff on and community health workers. And they wanted to address the perceived lack of the problem with the pain or the gain. So this would be a key message, or also called value proposition. The sexual violence training curriculum to educate clinical health staff and community health workers addresses the perceived lack of problem. Now, if you just think about how rich that product and service designer is with information, there could be multiple key messages for the sexual violence training curriculum, or for whatever your product or service or your fit was, by using the words and the data that is on that product and service designer. So it's a really key piece and an important thing for you to have. It has multiple uses to it. So there you have it, one of the tools, the product and service designer. It's there to help you identify your member and partner's needs. It's an intentional tool in order to do things intentionally. It'll help you identify potential products and services, helps you find that ideal fit, and it helps you develop those key messages. Now, when I think about the product and service designer, I think about the times that I have used it in network situations. And one particular situation comes to mind. When we use this particular tool, about 2 months after the site visit, I asked the network director, so when you think back to using the product and service designer tool, what comes to mind? What did you feel about it? And she said, my feeling was affirmation and confidence, because she said that the information that was on this tool, what her network looked like when the tool was filled out, it's what I thought it was. It's what I understood my network to be. It's what I understood my work to be. But she also said, when I was looking at network sustainability and looking at what products and services that I had that were making money and those that weren't, and thinking about what to drop in order to help with staff workload and so forth, I was going to drop advocacy. Advocacy was the #1 product and service, that soft S that those network members valued. So she said, I have not dropped advocacy. Matter of fact, I put more emphasis on it. So there's an example of how this tool was used. Another example is a network that had identified and knew the fit was right, but they needed to understand their target audience better. So they used this designer to say, okay, if our target audience is SQHCs, what are the jobs that they're trying to do, and what are their pains and what are their gains, and how can our community health worker training and community health worker service help them create their gains, help them relieve their pains. So they knew what that product and service was, but they wanted to take and really understand more what those needs were. But then this particular network jumped in and worked with the next tool, which is the business planning canvas, because they knew what their product and service was. They needed to do a member's needs assessment, essentially, of who that product and service was going to be targeted toward and what those key messages were. And now this tool, once you know what that fit is, like I was mentioning in this example, you can use this tool to figure out the feasibility of this fit or this product or service and how to take and implement it. And the business planning plan, this canvas is so perfect for that. This tool is really designed to help with market and business planning. It has three major sections. One section being that of the target market, another section being operational, and the final section is financial. So what are those target market pieces? Now, everything in this target market comes off of your product and service designer. The members' needs assessment. What are the jobs your members are trying to do or the problems they're trying to solve? What are the pains and what are the gains? What are the top pains? What are the top gains? Something that should be recorded on this business planning canvas. What is the description of your product and service? That's all off of your value proposition canvas. It's got the details of that business product or service that will reduce those members' pains and increase the members' gains. And remembering that it is in alignment with your mission and vision and your strategic objectives for your network. The final piece of the target market section are the key messages. And a few moments back, I described how you come up with your key messages, making use of your product and service designer. That next section is operational. This is where you figure out what your desired end user experience or relationship is. And what experience do you want your members to have while they're receiving or using your product or service? Do you want it to be personal? Do you want it to be interactive? Do you want it to be remote? What relationship do your members expect you to establish and maintain with them while they receive the service or use your product and service? Personal assistance, self-service, automated, co-creation. One of our network directors that's used this tool said, I just think about adjectives. And so when I'm thinking of words that would go here, I think adjectives. Product and service, communication, and delivery. How are you going to communicate this product and service to your members? How are they going to learn about it? And also, how are they going to receive your product and service? And what methods can you use to deliver it? Are they going to receive it over in a cloud-based system? Are they going to receive a program that they're going to download onto their computer? Are they going to receive it via personal training, or is it going to be an internet-based training? Just how are they going to receive it, and how are you going to be marketing it, or how are you going to let them know that this product and service exists? a real key piece of the business planning canvas for me is understanding what some of the key initiatives or actions are and what infrastructure is needed to develop in order to implement and support and to provide this product and service. What are the key resources, both in human, in time, and physical resources, tangible resources in order to take and develop this product or service? And finally, who are the key partners that you need to bring on board in order to make this product or service feasible or product or service happen? The third and final element of the business planning canvas is that financial one that we all have to very seriously look at, and sometimes it's truthfully one of the more difficult things to do unless we try to break it down into some really simple tools and a simple framework, of which I think that you will find in your business planning canvas worksheet. For the very end of it, one of the last pages helps you figure out some of those financial pieces. But one of the sections of the financial piece is to really look at what the development costs are for this product and service and what are going to be those ongoing costs, looking at the key initiatives and infrastructure and resources and identifying the costs related to it, and what things are one-time purchases, and how can you estimate the ongoing costs related to reoccurring fees and purchases and human resources. And then the flip side, you're expending, but what are you going to be receiving? What is that expected income? To identify a payment type for your product or service and estimate how much, or the price, and how often, the frequency, your members are willing to pay. Some payments models include selling a physical product, charging on a use basis or fee-for-service, subscriptions, fee-based for a time period, to rent, to lease the physical product, licensing, or intellectual property, like sharing staff, for example. This is a tool to be used after you've identified your service. Some of you may already have an idea of what those services are, and you can pick this tool up and figure out how you're going to implement it, figure out the feasibility parts of it, or use this tool to figure out what do I have and know already, but what do I need? Where are the gaps in my knowledge as far as what I want to take and do and implement? So to take and do some recapping, remember that there are hard services and